Induction of labor, prevention of postpartum hemorrhage. These are indications for oxytocin. For labor induction, oxytocin is given 1 to 2 milliunits a minute with 20 milliunits a minute as the maximum. After the delivery of the placenta, 10 units IM is given for the prevention of postpartum hemorrhage. Oxytocin stimulates smooth muscle of the uterus, producing uterine contractions. After the placenta is delivered, it causes the uterus to squeeze close to the attachment sites of the placenta so it stops excess bleeding. Oxytocin also stimulates the smooth muscles of the mammary glands to produce milk. Therapeutic effects include stimulation of uterine contractions in the lacteal glands, promoting milk ejection.
Potential and common side effects are maternal coma, seizures, hypotension, hypersensitivity, and painful contractions. The fetus can suffer infant brain damage, seizures, bradycardia, arrhythmias, and a low APGAR score at 5 minutes and even death. When monitoring and administering oxytocin, caution should be used in mothers who suffer from coronary disease or hypertension because it can cause arterial contraction and raise the mother's blood pressure or compromise coronary blood flow. Also, expecting mothers who have had cesarean births before are at risk due to oxytocin's effects on contractions that could compromise scars from previous cesarean births. Mothers who have unfavorable fetal position, uterine atony, or early pregnancy can also become compromised by uterine stimulation. Some nursing applications for oxytocin is for the induction of labor. The nurse should monitor frequency and durations of contractions, resting tone and fetal heart rate, and discontinue the infusion immediately if uterine hyperactivity or fetal distress occurs. A few things the nurse could teach the patient. She should explain to the patient that this medication will cause her to have contractions or make her contractions stronger. After delivery of the baby and placenta, inform the patient that the medication will cause her uterus to still contract to stop the bleeding. Tell the patient to report any site irritation, nausea, bleeding, blurred vision, difficulty speaking, wheezing, itching, and swelling. So oxytocin naturally occurs in the body, but sometimes mothers have to be given oxytocin to induce labor and to start those uterine contractions. So I'm going to show you basically what oxytocin does on the uterus. So here we have the balloon is our uterus, here's our cervix, and then we have a baby in there. So with Braxton Hicks, they're like this. You feel them, they feel like contractions, but nothing is affecting the cervix. Now, with real contractions, they're at the top of the uterine fundus, and then they contract and release. And as you can see, there's already some effacement starting to happen as they contract. So, the uterus will contract and then release. And then this process will repeat until the baby and the placenta has been delivered, but also afterwards to help control the bleeding. So we're having effacement of the uterus is starting to shorten. We're starting to see what we want. And then so the uterus will just keep contracting. But as you can see, since we're not really shortened all the way, there's not much dilation happening. But as you can see, as it progresses and we're really starting to get almost 100% effacement, we're really getting that dilation we want to see for the delivery of the baby. So the uterus is going to contract, and we're really seeing some dilation now. And so this will just keep on until we'll see some type of crowning and the baby is ready. So the uterus will contract and just keep contracting. And then we got some really good dilation going on. We got some crowning, and then we have a baby born. Disclaimer, the baby will not come out that fast.